All right, we're back in Senate Health and Welfare. It's still February 11th. And we're moving on to S-190, and we're going to hear from DFR. So welcome. Introduce yourself for the record. And
All right, Mary Block, I'm Deputy Commissioner of Insurance for the Department of Financial Regulation. Thank you for having me. The short answer is that we have absolutely no objection to S-190. We fully support the Care Board. With respect to the section on reference-based pricing, we certainly support moving reference-based pricing along as soon as possible with consumers and insurers and our entire healthcare system. With respect to the outsourcing sections, we also fully support that. We believe outsourcing can be very valuable where it can improve affordability and accessibility, but it needs to be transparent and there needs to be accountability. There's been a lot of work that's been done by the Care Board and by DFR and AHS and lots of organizations here in Vermont to manage rates and hospital budgets, reference-based pricing, Act 55, budget and rate orders, all being done to manage this problem that we have with healthcare costs. And we've done a lot of work to push insurers to negotiate heavier with the hospitals. So all of that work is not going to be effective if there's a lack of transparency and accountability for outsourcing, and it potentially undermines that work. Hospitals should be able to delegate functions, but they cannot advocate their responsibility for those functions. So if they're outsourcing a hospital function, then that vendor is acting as them, and the same rules should apply and the same transparency should apply. With respect to section 6 and 7, we really don't have any comments to make there. We have no objections to the section 8 relating to appeals from Care Board. Appeals to DFR orders also go straight to the Supreme Court. It's a very similar structure to other state agencies. And then with respect to the audit request, it's very similar to what we have in DFR, and our audit function is vitally important to the enforcement work that we do. The ability to go in and dig deep and ask those questions is very helpful to us in the insurance community, and I presume it would be helpful to the Care Board as well. And I think
that's it in a nutshell.
That's it in a nutshell.
So, and I do have some questions. I do have a question for you. So in terms, let's start with the reference-based pricing down the list. I'm pleased that you said reference-based pricing should move along as quickly as possible. Because I believe it should as well. What role, if any, do you play in helping, working with the board on reference-based pricing? How does that sort out with the insurance oversight?
So at this point, we haven't, the Care Board haven't engaged us in the work that they're doing, because I think they're still very preliminary in their work.
Yeah.
Obviously, when it comes time to be thinking about how insurers are going to process those claims with reference-based prices, how they're going to incorporate that into contracts, we'll be more involved in the conversations with the Care Board. And then obviously we will audit to those things as we normally do during the exams of the insurers.
Yeah, so the contract piece seems critical because the negotiation would happen a priori, before the rate setting. Always happens that way. But,
yeah, I mean, they're just finishing up the details of the negotiations for this year. It always bleeds over, but they have the sort of the agreement principle now, language. So yeah, it would be, they'd be working on the negotiations for next year, probably in the fall, sort of right after the rates come down. They would be working on figuring out the contracts for next year. There's a provision in this bill that would require me to put that in there anyway, so it just be the details amongst the parties.
Okay, good, thank you. Then the outsourcing piece, you said transparent and accountable. One of the concerns that sort of rides along with the outsourcing is what happens, to our provider taxes?
And that I don't, that's a big question.
It is a big question.
Yeah, and I am not a tax expert, so I won't have that one.
Yes, we need to sort that out, but what you were saying is that they can delegate, but they can't
Advocate,
abrogate the responsibility, so it still holds as part of the hospital.
yes,
So we're gonna have to sort out how to define that, so we don't lose, financially.
yeah, and that's the way we view it in the insurance world too, right? Insurers delegate, outsource things all the time.
Yeah,
Our expectation is that they're responsible for that outsourced relationships. So if something goes wrong, it's the insurer's problem.
okay,
They're responsible to make the consumer whole or handle whatever consumer issue it is, and then they argue out with the vendor in the background based on the contract terms.
anything else that you need to share with us that we need to know? I mean, we don't know what we don't know.
With respect to this bill, I can't think of anything. I mean, it's very straightforward and didn't seem to be an issue from our perspective. We make perfect sense.
Okay. And Senator Cummings is gonna help us with provider taxes.
Does it say tax in here?
Okay,
It's going down the house.
any questions, committee? This is helpful. Thank you very much, and we know where you are.
Yes.
Yeah. How much, typically, what's the cost of an audit as you go through, individual audits?
It varies greatly on the insurer and the complexity of their business. So we charge back for our things.
Yeah,
We contract out, use contract resources as well as our own internal resources and charge that back. But exams can go upwards of $300,000 or $400,000 depending on the complexity of the insurer. And some are a lot smaller than that. We have some very small insurers that are maybe $50,000. But there are some big ones that take a long time to do. We're looking at almost, in some cases, a full year of completing an exam because of the complexity of the business and what we look at.
any other questions for DFR? We're good. Thank you, Mary.
Well,
Very good. I know you brought your friend.
my chaperone always comes in here.
Thank you. We didn't have the phone today, so
No,
we might get there. All right. Thank you very much.
snow a little warmer. Oh, it was so nice, Mark. Yes. So much better.
Last week, there were some red faces that showed up.
Yes, you were here last week. I had to draw my face before I could testify last week.
It was the whole.
Thank you.
So today, thank you. Thanks for coming in. We are, for S-190, we will have the board and the hospitals come in to testify. They've been working together on finding some language that we can consider. So, with Jen, get there. And today is, today's a big day. It's Recovery Day, it's Disability Advocacy Day, and it's Vermont 211.
Yeah.
So Sarah Launderville is here. Thank you for being here.
Thank you for having us.
And, just take a couple minutes to talk with us about the Vermont Center for,
Okay. I did prepare some testimony to give a little bit of.
that would be terrific.
Yeah, okay, just to sort of give you a lay of the land, but good afternoon, my name is Sarah Launderville, it's good to see you. It's been a while since I've been in.
It is.
Well, so it's so nice to see you.
Too long.
And I am the director of the Vermont Center for Independent Living. We're a disability justice organization and we serve people statewide. But I'm also the president of the Vermont Coalition for Disability Rights, and we are here today celebrating Disability Advocacy Day. We're presenting in front of 17 different committees, if you can believe it. And so people are kind of all over and sort of sharing our message. And I'm also a person who lives with disabilities. The theme of this year is write disability rights into every bill. And so we're trying to, you're a little more familiar with disability rights because of the nature of your committee, but I was in agriculture this morning and sharing about that, and it was wonderful interchange. So thank you for being curious about and agreeing and letting us speak today. VCDR, we have 5 principles. Disability is a natural part of the human experience, putting community and supports before institutions, supporting self-determination and independent living, supporting for community-based living and peer support, and dignity and respect for people with disabilities, which includes access to education, housing, food, work, and inclusion. These principles are particularly important here because the bills you take up around public health, mental health, primary care, hospital oversight, children's service directly shape whether disabled Vermonters can live safely, independently, and with dignity. So for the disability community, what we tried to do in each of the committees is look at some of the bills that you're currently working on or the ones that you've just passed and sort of give some comments and feedback. So we wanted to highlight community access to immunizations matter deeply to our community is highlighted in each 545. And after the state of emergency for the pandemic was lifted, VCIL peers struggled with access to immunizations because while the state had moved on from protections, those who remained immune compromised were less protected in the public than ever before. So through a lot of hard work and gaining access to funds through a U.S. aging grant, VCIL operationalized the only statewide in-home vaccination program in Vermont, ensuring that people who could not leave their homes because of their disabilities, chronic illness, immunodeficiencies or transportation barriers could still receive those life-saving vaccines. So we did that for about 1.5 years. We went as long as we could, and then the money, of course, had gone away. So we're done with that for now. Many Vermonters told us it was the first time they had been included in public health response, and our teams traveled across every region of the state, providing vaccines in the home. And if not available, those peers of ours would not have gotten the vaccine at all. And this bill has parallel in how people with disabilities and others can be blocked and need access to vaccines overall. S-189 is another example of a bill that matters deeply to our community. When primary care practices shut down or relocate, the impact is not evenly felt, and disabled Vermonters are often first to lose access. VCIL recently received a call from an individual who suddenly lost their primary care provider because the practice had shut down. And they had been warned, but they knew it was coming, but it had shut down. And for someone with significant disabilities, there was transportation barriers to the next closest primary care physician who relied on regular care to manage their chronic conditions. And this isn't just an inconvenience, it was a complete loss of access for that person. Finally, I'd like to share part of a story related to a bill that was passed last year protecting healthcare workers. This past semester, VCIL ran a paid internship where we connected with disabled students, and they wrote their stories about their experiences in education and also other healthcare or other systems. It was really left up to whatever they wanted to write about. A 17-year-old student wrote about experiences in a local emergency department while seeking support during a mental health crisis. And this person has let me share this part of the story. I've never screamed so loud in my entire life. My voice was already sore, but screaming for my mom and demanding the workers put me down became a spectacle of the entire unit. After searching the room with my eyes and seeing my mom was nowhere in sight, I glanced up towards the ceiling. I could see 2 nurses smiling at each other as if it was amusing for them. And then it hit me. None of these nurses cared about me. None of them physically stopped me from slamming my head against the wall. And now I was seen as a show pony for them in the hospital. I became enraged with anger and tripped the woman holding up my right limb. One of my limbs was actually in my control again. Another nurse took the place of the woman I had tripped, and the man holding my left leg had repositioned his hand near my inner thigh. I started spacing out into a flashback again when I felt the tear in my shoulder. The pain continued, but so did the flashback, and my body was tired and exhausted from fighting everyone who was supposed to try and help me. I remember passing out. I don't know for how long I was out, but I woke up back as we entered the room towards the back of the building. My arm was aching, and I screamed that my arm hurt. The nurses lowered me onto a bed. I took my right arm from the woman restraining it, pushing my arm towards me. to which the nurse screamed to her coworkers that I had attempted to scratch her. She bent over, screamed into my face that she was pressing charges against me. To give a little bit more context, the hospital had removed this teen's mom from the room. And when the mom arrived home after supporting the teen through the crisis, they were let go that day. She was met with a phone call from the local police department with an officer wanting to come by to issue a citation for the 17-year-old who had just spent the entire day trying to seek mental health treatment. Last year's bill sought to create safety. It had resulted in a vulnerable teenager being re-traumatized. The workers also had thoughts that they could personally press charges, which is not accurate. And it created a power dynamic that is troubling. The bias of people in mental health crisis continues to be very present. And in addition, the teen's personal information of why he was in the emergency department is now also shared with the police and not protected and kept confidential. The teen sought support from Disability Rights Vermont, and the state attorney general decided not to press charges. But if the parent in a similar situation and doesn't understand that they could ask questions or assert themselves, the outcome could lead to a criminal justice system, including potential for jail time and $1,000 fine. This committee is so important to the lives of people with disabilities, especially people with disabilities. Sorry. I appreciate your work, all of your work. And I know that you care and you take time to think about these systems. So thank you again for this opportunity to share.
Thank you. And thanks for the story. Sitting behind you is the representative of the hospitals who is not tight.
I think we were talking on it. I think recently, maybe.
Thank you, Sarah. And yeah, as you've identified some of the bills we're working on that are important. Yeah, really very helpful. And we'll also be looking to see what the disabled housing recommendations are.
Yes.
Did work very hard on that.
Amazing. And there's a joint hearing today. God, I can't remember what time that's starting at 1:00, I think, for an hour that's being talked about those, all of those recommendations.
That's
so
good.
that's happening over somewhere. Yeah,
Happening
exactly.
somewhere.
Yeah.
Good. As long as it happens, it's important.
So much interconnection. Yeah.
Thank
Thank
you.
you so much. Yeah. Have a good afternoon.
And is this Allison? What timing?
You're ready to go.
Yeah. So Allison, you should come sit in the hot seat.
Okay.
And
Right there.
we've got just a couple minutes. Senator Cummings has to go to another meeting, but we will
Okay.
listen to your
Right.
United Ways of Vermont.
Yes.
What?
Yes.
You can be Allison and
I can be Allison.
I said you can see Allison.
Oh,
and-
yes.
We're neighbors.
Oh,
Yeah.
terrific.
Have a good day.
All right.
Okay, so ready to go then.
Absolutely.
Oh, great. Well, thank you so much for giving me a few minutes of your time this afternoon. So for the record, I'm Allison Lavagna. I'm the Executive Director of United Ways of Vermont and Vermont 211. United Ways of Vermont is the home to Vermont 211. And so I'm here today to talk about Vermont 211 because it is National 211 Day, February 11th. 211. It is the national day that we celebrate 211.
It.
Yeah. I want to talk a little bit about 211 and our value and our impact on the community. I'm not here today to talk about funding and budget, and I realize that our time is limited, but I also just want to quickly flag for this committee that 211's funding is at risk this year. The governor's proposed fiscal year 27 budget reduces our funding by $332,000. And thanks to the legislature, last year we received a sustainable level of funding at 1.64 million. And we really need to maintain that sustainable level in order to perform our core services and functions. We need to be able to respond to the changing needs in the community with different cuts and benefits changes, and be able to have appropriate staffing levels during our busiest call volume times of day, as well as to be able to respond during times of disaster, which are all the things that are expected of 211. With a reduction of this amount, these services and functions are absolutely in jeopardy. So I know that our time is limited, and Chair Lyons, if there's a chance to come back and talk more about that when your committee is having a bunch of conversations, we'd love to do
That's
that.
good. That's a good suggestion.
Okay.
Yeah, because we won't get the budget till after crossover.
Okay.
Yeah.
All right. Thank you.
That'd be great. Yeah.
So, but we're celebrating 211 today. And this is the National Observance Day, celebrating the three-digit resource that helps people all across North America connect to health. And here in Vermont, we provide
free statewide access to resources by phone, text, and a 24/7 searchable database online. Our mission is to promote the health and well-being of all Vermonters through a statewide information and referral system that streamlines access to community resources. Vermont 211 is also a nationally accredited information and referral service, and we serve as the centralized, trusted source of health and human service information for the state. We are often seen as the front door to those services for the community and to be able to provide confidential, non-judgmental, and barrier-free support, including interpretation services for callers who speak languages other than English. We are also an integral partner in disaster response and recovery, and we have arisen to the occasion to support communities as far back as during Storm Irene and COVID and the recent flooding events of 23 and 24. Today, our database includes over 11,000 services, and in 2025 alone, we responded to more than 61,000 contacts from Vermonters. We made over 22,000 referrals from those contacts, most often for housing, but also we do more than that. We provide support for utilities, tax preparation, public assistance, individual and family supports, veteran services, disability services, mental health services, services for older adults. We're the one-stop shop for all of that. Across Vermont, people are told to call 211 in times of need. That's the message, loud and clear. And demand is rising. We see spikes in call volume whenever there are a crisis or a change. For example, with the staff crisis back in the fall, and we need to be able to respond during those times. We anticipate more of that coming down the line. And many people are finding themselves in need of help, sometimes for the first time, due to all the changes that are occurring. 211 is critical state infrastructure, and we are who Vermonters will turn to in those times of difficulty and crisis. We're expected to absorb increased demand and adapt quickly to all the changes and deliver accurate and real-time information consistently. We have a warm person on the other end of the line when someone calls, and they are trained specialists. So they're also certified by the National Accrediting Organization on how to deliver information referral services and support individuals to not only address the primary need for which they call, but also find the underlying needs and provide services. So I know our time was quick. That's sort of all I have, but I'm happy to answer questions.
This is terrific. Thank you for the reminder. And obviously, as we get into the budget discussion, it'll be important to have you, center in on exactly what funds that are needed.
Okay, that would be appreciated.
Senator Gould.
Chair Lyons, thank you for your presentation. That's really helpful. I'm Martine Buick. I live in Burlington and represent Reduced Community Investments in Winchester. And I'm curious, you mentioned that you have interpretive services sort of embedded in 211. Do you ever contract with or work with Vermont Language Justice Project?
I was wondering if you're going to ask about that. I know you're sponsoring
Yeah.
bill related.
Yeah.
We just entered into a fiscal sponsorship relationship with that.
Okay, great.
So as of October, we are now officially the fiscal sponsor of Vermont Language Justice Project, which is just a huge value add. I mean, we're not overlapping in services at the moment, but we're collaborating. And Allison, the director, and I have been talking quite a bit about language access at 211 and beyond. And so we're really happy to be supporting the project. Yeah.
That's great.
Yeah.
Thank you.
You did?
Well, I don't think I did it, but
Well,
that's
you introduced your bill.
Thank you.
Spell our name the same way. So it's Allison and Allison.
One L.
But one L.
One L.
Yeah, no, it's great work. And I think the missions are so incredibly aligned because what they're doing is getting information, critical hard information to Vermonters. And so are we. And the access, when you combine the two resources, the access that is amplified is just really valuable.
I'm so happy to hear that. That's
Yeah.
great. Terrific.
If I can send some more information if you want related to the funding, either after this meeting or just at your request in the future.
Wait, hold on until
Okay.
we get to the budget.
All right.
It'll get lost in the slew of work. that we're doing.
Okay.
Yeah.
And obviously there's, you know, too much to explain here around the context and what we're asking in our needs, but essentially level funding is what we're seeking.
So has the call volume increased as a result of some of the changes that we're seeing at the federal level? Did you see that?
Yes.
Yeah.
This year, we had more than 61,000 contacts. In the last few years, it's been around 50,000, 50 to 55,000. So, you know, it's gone up. And when we look at a chart of our call volume per month between like 2022 and 2026, you can see where there's always a spike when there's some sort of, you know, crisis or change that impacts people's health and well-being and the services that are available. So in November, we had a spike when SNAP was threatened.
That's bad.
When housing rules change, we see spikes because people are calling to find out if they're eligible. When there's obviously a disaster, we have spikes, and we really want to be able to remain nimble to have the systems and the staffing in place to be able to respond during those times without it being always, you know, a crisis and a struggle.
It's destabilizing times.
Exactly.
You're gonna have to stop, but are you 24/7?
We are currently 24/7, and one of the ways that we're looking to improve services and, you know, manage our costs in a fiscally responsible way is by looking at staffing up during our busiest times, which is actually 4 p.m. to 10 p.m. That may look like reducing other times, but in order to, you know, work within level funding and remain responsive during the critical times, that's one way that we're looking at doing that. I can leave it these. I know that we were a couple of
Yes.
committee members, so easily please.
Good, thank you.
I appreciate the time today. Thanks for squeezing me in.
Thanks for being
And I
here.
look forward to talking with you more.
2:11.
2:11.
Make sure you keep the others.
All right. Thank you so much.
Thank you very much.
Hold on
So
a
that